You heard a few statistics. I want to throw out one more, 80%. The U.S. uses 80% of the world's pain medication, and we make up 6% of the population. The next 15 minutes or so, I want to give you an overview of what prescription drug abuse is, and then tell you a few things you can do to help prevent it. First of all, we need to make sure we all understand what drug abuse, prescription drug abuse is. I think we all agree that if somebody's using prescription drugs to get high, that's drug abuse. But if you come up to me and say, oh, I have a horrible headache, and I start digging in my purse and say, here, I have a Lortab. It always works on my headache. You can take this, and you take it. That's prescription drug abuse, and it's also a crime. To make sure we're all talking about the same drugs when we talk about the prescription opioids, these are known as pain relievers, painkillers. You'll recognize a lot of the names: Vicodin, Percodan, Percocet, Lortab, Lorcet. Some of these drugs are the opioids in combination with Tylenol, acetaminophen, which is the generic for Tylenol. So people who become addicted to the opioid pain relievers, if they're using the combination products, they not only have to worry about the consequences of the opioid addiction, they also have to worry about liver failure because they'll be taking the Tylenol at toxic doses. Fentanyl is the one that's in the news these days most frequently, and that's because so many of the overdoses have been attributed to fentanyl. This slide up here, it shows a comparison of the lethal dose of fentanyl versus the lethal dose of heroin. By comparison, if someone took a lethal dose of aspirin, an adult, it would take 100 tablets. As you can see in this picture, fentanyl is 30 to 50 times more potent than heroin. It's 100 times more potent than morphine. There's also another drug out there called carfentanil, and it's used as a tranquilizer for elephants. It's 1,000 times more potent. Another group of drugs that aren't opioids but that are often related to overdoses are the benzodiazepines. These are your Xanax, Valium, Ativan. And the reason for this is they're so readily available. There's tons of prescriptions out there for these. 30% of the overdoses of benzodiazepine is also involved, usually along with an opioid. I want to cover a few myths about prescription opioids. There was a myth out there that said that, they're not really addictive if they're used for legitimate pain relief. This myth was promoted by Purdue, who in 1995 got FDA approval of OxyContin. They wined and dined physicians, nurses, and pharmacists, and they promoted the drug as not being addictive if it was used for legitimate pain relief. By 2012, there were 256 million prescriptions for opioids. That was enough for every person in the country to have a prescription. Earlier this year, in February, Alabama started a lawsuit against Purdue. There are now about 20 states, give or take a few, that are suing Purdue, much like states sued the tobacco companies years ago. One of the things that just amazed me, was the sales reps that went around to the physicians. If the physicians were trying to tell them, you know, my patients, they keep coming in wanting more. And the sales reps would say, well, that's pseudo-addiction. That's not really addiction. You're just not giving them enough to relieve their pain. You need to prescribe higher doses. The fact is that after 3 days, your chances of addiction start increasing. And after 8 days, it goes up to about 13%. When a study was done with people on long-term chronic opioids, and a third of them admitted to being addicted. The other myth out there is, you know, my physician knows what they're doing. They're not going to do anything to hurt me. Well, the fact is there are a lot of physicians, nurses, and pharmacists out there that are fueling this epidemic. A little over a year ago, my husband had an outpatient surgery, minor procedure. The surgeon gave him 100 opioid pain relievers. He took 3. We had 97 left. 60% of Americans have leftover opioid prescriptions in their medicine cabinets. 70% of teens say that the medicine cabinet is their source of drugs. We had to get rid of those 97. And I'll go over how best to get rid of those in a few minutes. Now, physicians, as I mentioned, routinely prescribe more than 3 to 7 days of drug, which is the recommended number by the Center for Disease Prevention and Control. As you heard, Alabama has one of the highest rates in the country. This past May, a Huntsville physician was sued in a wrongful death case. This physician had prescribed over 3,600 oxycodone to this patient over a 4-year period. And in the last 2.5 months of the patient's life, the physician had prescribed 582 oxycodone. We have a problem. Blue Cross Blue Shield, as of this past April, will no longer pay for more than a 7-day supply of prescription opioids for a new prescription. Another myth out there was that, you know, the prescription drugs, they're safer. They're safer than heroin. It's not the case. 40% of the overdoses are from the prescription opioids. You heard Michael talk about Narcan. This is the drug that's used to reverse an overdose. This is probably more than you want to know about the pharmacology, but the Narcan competes with the same receptors that the opioid attaches to. So it knocks them off of the receptor and the person is revived. There are people out there that think making Narcan so readily available just encourages people to misuse opioids, but that's not the case. There is no way you can get somebody into recovery if they're dead. As Michael mentioned, it's available in Alabama without a prescription. The problem is if you go into a pharmacy and ask for it, half of the pharmacists are going to look at you with a blank stare and not know what you're talking about. We really need to educate the pharmacists in this state that Narcan is available without a prescription. Blue Cross Blue Shield will pay for it if you happen to have that insurance at the generic copay. It comes as an injection, a nasal spray, and an auto injection that's exorbitantly expensive. I do want to mention that if you have loved ones that have been in recovery or have been in jail and they were using, when they come out of recovery and if they relapse, that's a real risk of overdosing because they will start using at the rate they were using before they went into recovery. The same way if someone's had a period of abstinence from being in jail. So you really need to have the Narcan on hand. How can you help with prevention? Talk to your physician. Ask about non-opioid alternatives for pain relief. There's steroid injections, there's physical therapy, there's nerve blocks. So talk to your physician about non-opioid alternatives. If it's determined that this is the only thing that will work, then ask for a limited supply. If you've got a family member taking an opioid, monitor their intake, especially if you're dealing with the teen. I was surprised at how many prescriptions are given to adolescents and children. In Tennessee, they did a study, and 1 out of 10 children on Medicaid had gotten a prescription for an opioid. 30% of them were for dental procedures. Lock up the meds. Don't leave them in an open medicine cabinet, and get rid of the unused meds. Candy went over some of the locations and the fact that we have take-backs. Since the take-back started, Madison County's got 24,000 tons collected. So this is what you need to do. You remember I said 60% of people have these opioids in their medicine cabinets, and 70% of teens say that they get them out of the medicine cabinet. Don't let your medicine cabinet be a drug dealer. Get rid of them. If for some reason you can't make it to one of the drop boxes, do not flush it down the toilet. Crunch it up, put it in cat litter or coffee grounds, put it in a can or a baggie, and put it in the trash. The government and industry has been trying to do some things to combat the opioid drug crisis. As I mentioned, those products that are in combination with Tylenol, used to you could get those refilled up to 5 times over a 6-month period. That's no longer the case. They're treated just like the single ingredient opioids, and you have to have a new prescription. The drug companies tried to make abuse deterrent formulations. They would turn into a gel if you crushed them in added water. If you tried to snort them, they had pepper type preparations in them. They didn't work, and some of them have been pulled off the market already. We mentioned the state drug monitoring program that can decrease doctor shopping, and also the CDC guidelines that are now saying, 3 days is probably sufficient, and you rarely need more than 7 days of an opioid.